Today's healthcare system is struggling. From physician shortages to chronic disease epidemics, there's a lot going on. But what if we could solve these challenges with a new model of community-driven medicine that focused on group visits and support? Our guest today believes we can. He's an author, speaker, community builder, and healthcare entrepreneur. This is the story of the community cure with James Maskell. James, thank you for coming on.
Hey, great to be here with you. Thanks for having me.
You know, one of the interesting things I found out about you when I was doing some research and what you gave us was that you have a degree in health economics from Nottingham University. Yeah. And it's obvious that led you to where you are now, but what even brought you to health economics in the first place? And what exactly does that mean for an audience that's kind of trying to figure out what that degree brings you?
Yeah, so I was interested in economics. I did it at school, and then I applied to read economics at Nottingham. And in my first year, I did one of the sessions on the food economic system, and I thought that was really interesting. And then, you know, through the rest of my degree, I had a chance to sort of specialize in certain topics, and I did quite a lot of stuff on the healthcare system. And that was really where I started to look at essentially the cost of delivering healthcare and how it varies across all the different nations. And it became clear that both there in the UK, where I grew up, but also in the US, where I was born, and I had the passport, very fortunately, you know, healthcare costs were on a exponentially upward trajectory, right? So going up and going up really quickly. And as I dove more into that, I could see that that was off the back of chronic disease. Mm-hmm. So, you know, as I'm writing my thesis and really understanding that, I'm sort of realizing that in my lifetime, this is going to happen. Yeah. Right. It's not like at some time in the future, you can see the numbers keep getting bigger and bigger. And if you understand that the driver of is chronic illness, and you see the numbers of people with chronic illness and the percentages of people going up, you know, you start to think, well, what's the plan? You know, is there any plan? And ultimately, you know, I just knew that there was a different way to do healthcare because I'd grown up as the weird kid that did natural medicine. So, you know, I was the only kid in school whose parents insisted that I not be given antibiotics. And that was in the 80s, you know, 30 years ahead of, you know, antibiotic resistance. Like I had a chiropractor growing up, and the first thing that I would take would be homeopathic remedies. So I knew that there was a different way to do it. I knew that we were on this unsustainable path. And for a while, I just ignored it. Like I took another job as an investment banker in London. And I was like, you know, I'll just get on with doing what normal people do. But it kept on gnawing at me. And about in the beginning of 2005, I had sort of a crisis of conscience where I was like, man, this is probably a more interesting thing to do with my life. And I was given an offer to come to America and work in a clinic that was reversing chronic illness. And I was like, I want to go and see this up close. I want to understand chronic illness, where it comes from. And the first question that I had is it reversible, right? Can you take someone who is chronically ill and can you get them back to a point where they're no longer chronically ill? And that was 17 years ago. And it's been a learning journey ever since.
Yeah, it's funny. Me and you probably have similar paths because I was a pretty weird kid too, with a lot of homeopathy and herbology. And I traveled the world with my father, who was a conventionally trained doctor, but just said, like, enough is enough. I can't just keep giving crutches. He was in pain medicine. So at the time it was like epidurals or pills or surgery. And that was it. And he said, there's got to be something better out there. And then he realized all the chronic disease that were kind of circling around him as well. And he came to that same realization, I think, that we did. This is unsustainable. And when people ask me why I do what I do, it's not to get into business or anything like that. It's because of this. If we don't do something, this just can't keep going in the way it's going. We're already at 60 to 80% chronically ill. That number is just going to keep going up and up. Why do you think more people aren't as alarmed as probably me and you are? I mean, we know there are communities out there, but the majority of healthcare right now is kind of going with the same path. Keep throwing drugs at it, keep, you know, big pharma, everything like that. What do you think it is that people aren't seeing that this isn't sustainable?
Oh, man. Well, look, it's the most vexing problem on the planet, right? Because there's so many factors that go into it. It's not just one thing, right? You could say, well, it's the food, but then you realize it's the environment, it's the air and the food, you know, there's all that kind of stuff. But then it's the social side of it, the social determinants of health that drive it. You know, there's all kinds of of sort of factors that play into it. So it's complex and multifactorial. I think there's been a big shift in the last 17 years. I think a lot of people know now that chronic disease can be reversed, right? I think, if you look to, where we were in 2005, I mean, you basically have no podcasts, no summits, no books, no content that's being created, no people showcasing their own, transformation of their own healing journey to reverse a chronic illness. So I think the last 17 years has seen as the sort of the ability to publish went from something that was only very narrow to something that's very broad. We've seen, thousands of people publishing their own story of chronic disease reversal, or in the case of, some physicians and other people showcasing like strategies for specific areas. So, that's been transformational, I think, for the general public to understand that chronic disease is reversible. So I think that's been a big step, but, sort of it's kind of obvious on a one-to-one basis. It's like, okay, I can read this book and I can take action for myself. What I think there is a big gap in, and possibly you and I are aligned on that too, is really thinking about how can that knowledge be deployed at a meaningful enough scale to actually tackle the problem at the level that it exists. And that's something that, I've just been thinking about for 17 years. My first efforts at it were, well, the first thing is that I learned for like 7 years. So I worked in that clinic. I saw chronic disease being reversed. Then I wanted to know, is this just a one-off, or are there many other clinics that are doing similar things where the results are the same? And so I took a job selling to those kind of clinics, and I saw that there's a lot of different sub niches of alternative medicine where there's a lot of great work being done. They don't have a common language. They don't have a common thesis. They don't even have a common set of tools. There is a lot that they do in common, but ultimately, it's just very siloed. And so that was what I learned for a while. And then in 2014, it sort of there was 9 years into it, was when I really did the first thing that took off. And that was really trying to, one, bring all those types of practitioners together into one room, two, talk about how there could be a common language. And that was sort of some of the foundations that I thought needed to be there, so you could build provider teams that could work together and do it in a more resource efficient way. So, it's just been a process of learning and trying to understand all the different factors, seeing where there's friction, seeing where there's pressure, seeing where there's opportunity. And then, like yourself, I think that commerce is a really powerful tool. And if done well, can lead to the kind of significant changes that we need to see. And so, it's a learning process in progress.
And that whole adventure you did in 2014, was that the start of the functional forum?
Yeah, exactly. So, in 2011, I got my first speaking gig, speaking to doctors. So there was a conference called, what was it called? Heal Thy Practice. And it was for doctors that had were wanting to leave conventional care and wanted to try and practice in a new way. And it was sort of a practice management conference. And I got to speak at that conference, and that gave me a lot of confidence to think that my ideas were valuable, and that I did have a unique viewpoint on the state of medicine. And that especially as, at that time, 2011, you really have the beginning of this sort of medicine meeting technology too, right? Where there's the first electronic health records, and there's the possibility for telemedicine and, those kind of things. So from 2011 to 2013, I did some of that. So I started speaking at conferences and sharing sort of my ideas on practice management. Yeah, and then 2014, I'd been out to LA. We did an event in LA in 2011, and I recognized in LA, there was a meetup for all doctors that were interested in doing sort of different models of integrated functional lifestyle medicine. But there wasn't anything like that in New York. So the Functional Forum started in January 2014 as initially a meetup for doctors who were interested in that kind of care. But I had done so many small events over the preceding 7 years, and sort of recognized how to do those in an effective way. And so the Functional Forum became like a live studio audience show. So there'd be some mingling before and connecting, and then there'd be a 90-minute live show. And at that time, there was really no content online for free that was for doctors that were interested in this kind of care. And so we just were kind of like the right thing at the right time. And where the biggest conference in the space was probably 1,000 doctors, by the 8th episode, we had 30,000 watching just because it was free and anyone could watch it anywhere in the world, no matter if you were in Nebraska or India or Australia or New York. And so that was sort of the beginning of, I guess, me having some influence in the functional medicine world.
Yeah, no, I remember when that first started. I was in New York City as well, and I was still working at and with a practice at the time, and then working a lot on the corporate side too. But that took off, and that did really well, and it showed the need for practitioners to come together. Because I am just like you, I've found a lot of disjointment within integrative and holistic healthcare. You have a lot of these great specialties, but a lot of them are still working like conventional medicine as specialists and not speaking together in their own niches, just sitting there. And so the coming together and that idea of community is very big in medicine, and it's something you wrote about in your second book called The Community Cure. And, you even bring up this idea of group visits, improving patient care and costs and everything. Can you go into that? Because that's very interesting, as most people are just like one-on-one, you have your appointment, you go in. What does a group visit look like?
Yeah, so it was actually at that conference, Heal Thy Practice, in 2013 when I heard about the group visit for the first time. And my economist brain could never get around the fact that in almost all cases, whatever kind of functional integrative lifestyle medicine was being delivered, the initial thing that happened was an extended visit with the most expensive provider, the doctor. Right. That was how all these appointments started. And that was really the value proposition that those doctors would say. Like, okay, you work with me, you're going to pay cash, but I'm going to spend the time with you to really go through your health history and work out what went wrong, when, and why, and then start to understand how we can bring you back to health. That was the way, that's still the way that the majority of that care is delivered. And I couldn't get out of my head the fact that this is a terrible plan, right? If you want to scale this care. Right, because one, the amount of friction in getting a doctor to actually see that maybe their medical education didn't give them the tools enough to get them to reverse chronic illness, that's a huge friction point. That's like humility at scale, unlikely, right? Then the second thing is, now you reorganize your practice to be way less efficient than primary care, right? You're going from a 7-minute visit to like an hour and a half visit. There's just no way that can work at any sort of scale. And that's what we see is that, yes, there have been efforts to sort of productize functional medicine a little bit, but still today, the only way that you can get that kind of care is at best $100 a month, membership, and at most obvious a $5,000 engagement over 6 months, right? Depending on how chronic your issue is and who you sign up with. So that's the state of that care now. And in 2013, I saw a lecture by a doctor who was just like, look, I'm in primary care. I wanted to do this functional lifestyle integrated medicine. I had 16 patients that were all type 2 diabetic on the afternoon. So 2 days before, I just said, hey, instead of me seeing you all one by one, why don't you just all come at the same time? And we'll at least, we'll have a conversation between everyone and we'll be able to spend the whole hour and a half with you rather than 6 minutes each. And that was the beginning of a journey. And are there benefits to treating people collectively, like as a group? And, first of all, it triggered in my economist brain, wow, this actually is unbelievably resource efficient because now, yes, you're having the hour and a half with the doctor, but 16 people are doing together. And then when you come to understand that actually one person can help another person for free, right? One person's journey is valuable to another. Now you've got a shot at doing something that can really scale and really work because ultimately, it's radically resource efficient. It's not radically resource inefficient. Then throw on top of that, if you do it in the insurance system, it can be profitable to do because you can bill all these people with the same insurance. Their insurances are for the same provider time. Suddenly I'm like, this is reasonable. Like, this seems like something that could really happen and work and scale. And so I just kind of got really interested in it. So in my 2015 TEDx talk, I talked about it. And then, I was just sort of like paying attention to it, talking about it on the functional forum here and there, really interested in different people's models who were, doing interesting forms of group care. And then in 2019, it's a big moment. It's like my business partner passed away. So he and I had met in New York. He was one of my customers when I was a rep. And he had got into natural health because he'd had cancer twice. And really the second time that he got it, realizing like, I've got to do something. Like, I've got to be participant here. I can't just like wait for the doctors to take care of this, because ultimately, like, I'm dying. And that led him to health coaching. That led to him taking care of his own health. And he passed away in 2019. And it was just a moment to take stock. And I realized at that moment, the plan of trying to get doctors to switch over was necessary, but not sufficient to solve the problem. And it couldn't, like, the natural end result of my efforts couldn't solve the initial thing that I'd started out on. So I just took that year off and I wrote The Community Cure. And in that came off, one, interviewing so many interesting people that were doing interesting stuff with groups. And the first guy that I interviewed as part of this like 13-part podcast series that I did, as soon as I interviewed him, I was like, this has to be a book. Like, this guy was incredible. His name's Dr. Jeffrey Geller. He had essentially built his own model of group visits. He had done it in the poorest populations of, immigrants in Massachusetts. Some of these groups were still going 20 years later, and they were no longer type 2 diabetes groups because everyone in the group had reversed their type 2 diabetes. They were now salsa dancing clubs and gardening clubs, depending on whether it was summer or winter. And I was like, okay, that's amazing. And I want to follow that thread. And through that process of writing the book, I saw that actually in every clinical niche there is, from pregnancy, where the biggest group medicine in the country at that time was called centering pregnancy, where they essentially just put pregnant women into groups together through their pregnancy time. And you see a 35% reduction in preterm birth with no intervention, just people connecting, right through to some of the more famous examples like Dean Ornish's heart disease program, reversing heart disease, and, reversing type 2 diabetes, reversing Terry Wall's reversing MS in the VA. So I started to see, wow, there's actually, again, in silos, incredible examples of a new operating system of care. You can call it functional integrative lifestyle medicine, paired with this group methodology, was now both clinically potent enough to solve the problem and resource efficient enough to solve the problem. And then that was like, okay, we need to like triple down on this. So I wrote the book. The book came out in January 2020. And then COVID hit and all group medicine was destroyed, right? All the fledgling functional medicine groups at the Cleveland Clinic, done. These all, every Alcoholics Anonymous, done. No Overeaters Anonymous, done. Narcotics Anonymous, done. Addiction groups, done. Everything done, because you couldn't sit in a room together and there was no technology to really scale it. And so, that's been the next step in the journey, was to think, okay, I've spent the last, 15 years now convincing myself and now finding a model that I think can solve the problem at the level that exists. How do we create a way to take all the friction out of adoption? And there's a lot of factors that go into that, right? You have to, does it work? Can it scale? Will patients want to do it? And will we find someone to pay for it that's not the patient? And that's what I've been working on the last 3 years.
Yeah. I think the notion of scalability with a lot of this has plagued a lot of people, including myself. I know that's part of what brought you to the Community Cure. Do you feel that it's kind of like the old ways versus the new? Because scalability, if you brought in healthcare practitioners, not doctors, but healthcare practitioners to see through a lot of these lifestyle changes. I mean, listen, there are wonderful NPs, PAs, nurses out there, so many more than MDs that probably aren't as indoctrinated into the old ways and would be able to serve as scale. But you would then need the patients in those group sessions to put their trust and faith in someone that's not a doctor. Do you think that's a viable option as we move forward and we start to see experts who don't have MD on the end of their name giving out a lot of health advice and information that people are actually listening to and getting better, more so than their MD gave them?
Well, it's an interesting question. And there's actually a very left field answer for this, which is, I think you're going to like. So from our experience, any sort of expert running the group doesn't really work. And when I say expert, I mean doctor, nurse practitioner, dietitian, even nutritionists. Like, that doesn't really work. And the reason is because there's this sort of like, I think there's a number of reasons, but one of them is that like there's this historical sort of sort of dynamic between patient and expert, right? Where one's above the other. And that's really the opposite of what you're trying to make happen in the groups. You're trying to empower the patients, right? You have to see them as capable. And so we've actually found that the most successful person to run these groups is actually what is called a health coach. And the reason why the health coach is really valuable is, one, they typically have some patient experience of being the patient in that situation, right? So how do you get a group of patients to really feel safe enough to participate in a group if the first thing that they hear is that someone who's kind of like them, had an issue that was kind of like them, and they did this, and this, and now they don't have that issue? That is extremely reassuring and trust creating in a way that a doctor says, well, if you do this, and this, you'll be fine, but it hasn't worked up until now. That's a piece. So, and also a health coach is a very scalable, person, right? It only takes 6 months to a year for them to like go through their training, and then they have to have some experience in doing it. But ultimately, what you're not is an expert. What you are is really a facilitator. And the way that we've sort of got around the issue that you're sharing there is that, we've created a bulletproof program. That program is prescribed by the doctor. So all the information there is sort of coming from the doctor as far as like what to do. The coach is really there just to help you be accountable to that process. So what we've done is sort of really thought about team-based care, who should do what, which parts of it are scalable, where is the trust, where is the skill set, and sort of come to what we think is a pretty elegant solution, to essentially scale group delivered care. And it's not necessarily a replacement for one-on-one care. We definitely think that, that there's plenty of examples and data. Now, if you look at the British Medical Journal, April 2021, that showcases that the group outcomes at the Cleveland Clinic Center for Functional Medicine, you'll see that the outcomes are sensational. The costs are lower than one-on-one care. The outcomes are better than one-on-one functional medicine. And there's many reasons for that. But what I've seen more than anything over the last 3 years of doing this pretty intensely is that, creating trust, solving loneliness, creating connection is the most important thing. And we found that, doctors have said things to us like, when they go into these groups, they say, patients have shared things into the group that they haven't shared with me. And I've been their doctor for 7 years. And so there's a level of trust that's created in a group of peers where you don't have the doctor involved that I think is a really powerful force for scale.
Yeah. The one thing I've always thought about medicine that was lacking growing up in the industry and everything is the humanization, the ability to emotionally tap into each patient, connect, which most experts and doctors don't do. But you're right. It is those health advocates, ambassadors, those health coaches that usually have their own conditions that they've gone through that you're able to then empathize. And that's really what so many patients seek. They don't seek the professionals. Listen, if that were the case, conventional medicine would be amazing if everyone just wanted the science and evidence. But that's definitely not enough anymore. You need sounding boards as you start to heal, I've realized. And most of these patients out there, that's what they're looking for. When you give them that ability to speak longer with a doctor, sometimes that's not enough. And so I do agree with you there. And part of that, of what we're talking about, is this idea of loneliness. Experts can make you sometimes feel lonely and, just isolated, where this group sort of session can get rid of that in a sense and combat that. And listen, there's been the studies that show loneliness is like smoking 15 cigarettes a day, the same impact on you. Do you feel that through the pandemic, that's just been a lot worse, meaning that so many people are isolated, and here we are kind of divided as a country, still isolated a little bit, still in our kind of loneliness of just ordering packages to us through Amazon and sitting home? Do you feel it's gotten worse?
Definitely. Yeah. I mean, I think anyone that's paying attention sees that it's got worse.
Yeah.
And it's permeated through more of society. You've had like almost like enough time that the pandemic was going on to like have new behavior norms, that are slowly coming back depending on where you live. I think it's got a lot worse. I think it's a huge issue. I mean, the book was actually going to be called A Cure for Loneliness at the beginning, because these groups do cure loneliness, and loneliness is the biggest driver of all-cause mortality, social stress and loneliness. However, the reason why it's not called that is because there's more that happens in the group than just solving the loneliness. And you hit on it a little bit here, is that what happens in the group dynamic is that, patients sort of egg each other on to do things that they wouldn't do if they didn't see other people doing it. So like in every group that we've seen, let's say a group of 20, if you say, hey, we're doing this week, we recommend doing this, this, and this, there's going to be a few people in that group that just do it because they're like that kind of personality type. They do it, and 2 weeks later, they're ready to report that they did it. And wow, the outcomes are amazing already. They've got a new sleep hygiene. They're doing some stress reduction techniques. They've added some vegetables. They're, eating a less inflammatory diet. Whatever the thing is, they're just a quick start personality type. So, what's really helpful in the groups is you start to see that those people actually get the people who aren't that type, who are like, I don't really believe it. It takes me longer to get things going. And they see, well, look, Tracy did it 2 weeks ago, and look how well she's doing. I'm going to do it. And the biggest thing that I would say, Casper, is just to think that if you're trying to get healthy, have you ever met anyone who's trying to do what you're doing? Right. And if you haven't, that's probably a problem, right? Especially someone who's been successful. And so meeting other people who've been successful in the journey that you're trying to take is critical. And the thing that really hit for me, this was like a moment of clarity that I had in 2017. So some of your listeners are probably familiar with Dr. Terry Walls. So she reversed her own MS with functional medicine and then has been looking to scale it in the VA. Incredible woman. I mean, literally like the Mick Jagger of MS, right? She's like, she's gone from wheelchair to riding, her bike, thus far and being such a leader. So she told me that when she started running these groups, she said that the person who's been in the group a few weeks longer and has made some changes with, and shops in the local shops that everyone shops in and can come back and tell that person that person's actually more inspiring to the newbie than the Mick Jagger of MS, than Terry Walls herself, who's in there in the room. You've got this huge celebrity who's done exactly what they're looking to do, and they probably all look up to her because of her incredible story. And yet, this other person's more exciting and enticing to them. And I think that's such a critical piece, because what that essentially shows is that there is a lot needed in the 0 to 1, right? Actually, 0 to 1 is where all the action is, right? Going from doing no healthy behaviors to doing your first one, seeing that work and then building upon it. That's where we have to do most of the work. And most of that work is best achieved by someone seeing someone else who's already done that 0 to 1 and maybe is at 2 or 3 and seeing, actually, that doesn't look that hard. And that person's kind of like me. And, I can manage that. Because a big issue that I saw in these functional medicine clinics that I would go around and see, the protocol is way too overwhelming. Right? You're saying like, change these 7 things about your life and take this whole new set of supplements. That's a lot, right? That's basically impossible. And yet that's the standard of care in this like emerging field. And so I guess the whole point of what I'm working on now is really the thesis that how do we do the 0 to 1 better?
Yeah.
Right. How do we do the 0 to 1 in the best way for 0 to 1? And we'll work out level 10 to 100 later. But like, how do we get people from 0 to 1 to start that process? And I think that looks a lot more like peer groups and a lot less like paternalism.
Yeah. I've noticed that often overwhelm is the greatest predicator of stopping and just not giving into a program of treatment, let's say, or a way back to health, because it is the 7 different things. I mean, a lot of people have poor habits, unfortunately. They have routines that led them to disease. To just turn that all around at once is not really realistic. It's almost chipping away one thing at a time while you serve as a catalyst in those different ways. But one of the things you said is that in this model, you're going to need people that have been successfully healed, in a sense, gotten themselves and reversed disease. Does this model then can it be at all applied to conventional medicine whose level of success isn't reversing disease, it's managing it and symptom resolution and kind of, Band-Aids?
Yeah, it's a great question. Right. So I think coming into this world naively at the beginning, I was like, well, if I could just show the doctors that this is possible, surely they'll just do it. And that's not the case, right? There's a lot of friction in that transformation. They don't believe it. There's not enough data. If it was real, they would have heard about it. This isn't science. This smells like something that I've heard to be told to be wary of, all of that. So, and then also like the purpose of my book was to try and like make it as easy as possible to make that shift. But there's still a lot of friction in there of adopting these groups. And that's why, up and before the pandemic, group medicine is amazing. Like, why hasn't it been adopted everywhere? Why hasn't it grown? Why hasn't it scaled? Why isn't it the standard of care? It's new and it's different and it takes a bit of time and there's all this friction in delivery. So in the model that we've created now, what we have is that we deliver these groups as a service to existing healthcare infrastructure. And so what that means is the doctors don't have to learn anything new. The patients, the payers that pay for conventional medicine, i.e. Medicare, Medicaid, commercial insurance, pay the bill, right? So there's nothing new has to happen. The doctors, they have providers, they have insurance contracts, they have patients, and we partner with them to deliver these lifestyle medicine groups as a service. Now, we've positioned it hopefully in such a way that it is the least offensive to your average doctor, right? So, most doctors, when you speak to them, would agree that patients should do more healthy behaviors. And I've told them a million times, and why won't they do it, right? So let's just start with that. They may not understand systems biology. They may not understand supplements. They may not understand esoteric lab testing, there's all things that they don't understand or they can't get on board with, but what can they get on board with? And what we found is that, doing lifestyle medicine, especially if you could do it in a sort of a profitable way, right? And an organized way and a way that extends their care team and allows them to make more money. And, sort of, if you can really think about positioning it in a way that reduces all the friction points, you can get some traction. So that's kind of what we're focused on now we've created a sort of a delivery system for virtual lifestyle medicine groups. We sold it initially to clinics that took insurance, but had some sort of interest in functional, integrative and lifestyle medicine. But now we're starting to sell like hospitals and health systems and bigger entities. And the whole point is like, let's not have a plan where the hardest things to do are necessary to do in order for it to work. Let's try and do it the easiest things to do. And that's just iterating, learning, throughout this time and just trying to ride the wave as opposed to, fight the ocean.
Yeah. Now, I know that a lot of medicine is basically based and predicated on a patient waiting till something occurs, they become diseased, ill, and then they go in. And I do believe that the community model is a great one for chronic illness. Do you think it could be applied to preventive medicine as well and health optimization? Because, if we really want to get ahead with this and turn this around, it's not just about reversing disease, it's getting ahead of it. It's saying, let's not get disease in the first place and let's start to prevent it. But as we are now, most of medicine is just like, wait, it's basically saying you don't need to come in till there's something wrong. Do you think this model can be applied to a preventive kind of proactive stance?
For sure.
Yeah.
So I would say, I mean, just to like open the kimono on the plan, ultimately there's most health systems in America, 70% still operate on a fee-for-service model, right? Where you bill insurance for everything that you do. And I think all of us could probably think that that's not a great model because it incentivizes the wrong thing, doing too much stuff. And it doesn't incentivize you to actually make anyone healthy. It just encourages you to do more stuff. But that's the way that it is. And I spent a lot of time before thinking about, well, how could you change that? And I don't know if I can change it. There are certainly people who are doing an amazing job. Look at groups like Hint Health that have like basically like a countrywide network of doctors that do like a membership model that has much better incentives. So there are people that are doing cool stuff in that regard, but I didn't know if that was on me. So the plan right now is that we ride the wave and help entities essentially deliver this group's lifestyle medicine in a profitable way on fee for service and essentially build up our technology and build our capacity and build the scalability and the delivery system of it. There is another wave that is happening in healthcare that speaks to exactly what you're saying. There is a shift happening now. It represents 30% of healthcare where people can get paid more if you keep people healthier for less. Right. So that's coming. It's called value-based care. It's pretty boring. It's been coming for 10 years. It's pretty slow, but it is starting to accelerate. And so you're starting to see like what they call capitated models where basically they say, okay, we're only going to give you X amount of money and you have to work out how to do it. And therefore, if you can keep people well at the minimum possible cost, you win. And the medium-term thesis for Heal Community is that we will have with Heal Community, as we get to scale, the most efficient system that could ever be created for keeping people healthy at the minimum possible cost. Because over time, yes, there will be health coaches, but over time, that might actually turn to actual peers, right? We've done a lot of testing thus far on like peer-to-peer coaching, right? So you and I could be in a group and we're not trained as health coaches, but if I can support you in your journey and you can support me in my journey, and it doesn't cost either of us anything, it's pretty awesome. And so, that's kind of where we're headed. And to try and work out that now takes a lot of like iterations, probably some machine learning, to really understand like how do we maximize the relationship between two people, between a person and a group. But that's sort of where we're headed. So the goal is, can we create a system that is designed from its very initial essence to help people support each other in doing the basic healthy behaviors. Now, that won't reverse everyone's chronic illness, right? But it will take a pretty big chunk out of it.
It'll definitely take a big chunk out of it. And, the one thing I've seen is that a lot of medicine right now is going away from blanket protocols to personalized and tailored protocols. How does that fit in within the group model, the community model, where you have a number of people there, but you're still trying to take in the personalization of each and provide them without sort of these general protocols or general, treatment plans, and really try and give them uniquely what is right for them? Does that fit into this model?
Yeah, absolutely. So in the book, I go into quite a lot the fact that group medicine and personalized medicine are actually not mutually exclusive. In fact, I also argue that one leads to the other, right? The thing about personalized medicine is that there's a base layer of participation that's required to do the personalized medicine. Whatever that personalization is, typically you have to do it. So you have to take the supplement or you have to do the specialized exercise. So what you see is that most people, that's not a 0 to 1 conversation. That's a 5 to 10 conversation. That's like after you've got some traction in actually doing some healthy behaviors, how can you personalize it? And in the book, I share some models on how some innovative functional and integrated medicine clinics have been doing things like lab testing in a group where everyone has their own unique results on their computer. The doctor's teaching all of them about what those lab results mean at the same time. So it's super efficient, but also then patients ask questions about their lab results, and those questions actually help other people in the room. And so, everyone's getting their own personalized program, but they're being empowered by the other people in the group. And I think there's some real potential there. I don't think anyone's unlocked that at any sort of scale, but certainly, I'm thinking about, how that could work in the future. And I would also say that the ultimate personalized medicine, Casper, is people working out what they want to do for themselves. Right. It's not some expert giving them a personalized protocol. It's coming from them knowing what they need to do. That's coaching. That's what happens in coaching. You're looking at the gap between what you want and what you do and working out why that gap exists and how to close that gap. That is a deeply personal process. And that is what happens in the group every time. If you look at the group, what is the first thing that we do is we set SMART goals. Anyone who's in the business of behavior change or whatever understands the power of, SMART goals and what they do. But when is that being done in medicine? It's never being done. So the first thing that a SMART goal does is who comes up with the SMART goal? The patient, not the doctor, right? The patient comes up with the SMART goal because they're the ones who are going to have to do it. So like inbuilt in that is a deeply personal standard of care.
Well, I'm a big believer of purpose-driven medicine, finding that SMART goal, finding the why you're going to get better, because for many years you've been chronically ill, jumping around. And even if given the chance, if you don't have a why, you'll probably end up diseased again. You'll probably end up where you started. So I'm a big believer of that. Yeah. And I love the idea of, tapping into your own intuition as part of personalized medicine. You have to figure things out on your own because it's not on the onus of the doctor to give you that and get you back all the way. Some treatment, sure. But isn't this also then a changing of the medical model, not just on the patient side, but also on the medical side itself, the clinical side of a team that works together? Because if you have individuals, and that's how most integrative centers work, if you end up going to Dr. Smith rather than Dr. Adams, you're going to get a very different treatment plan. It'll, coincide differently. Different nurses may do things differently. I know where we work, it's very team-based. You don't get an individual practitioner. You get the team when you show up. And you do get that sort of model of everyone's on board on somebody's program of treatment that involves that patient, of course. But don't you think that needs to change also, where it's not so separatist and you have a model that's meeting groups with your own team and groups of kind of clinicians and experts, or shouldn't say experts, but also people that work on that side?
Well, Casper, I think one of the things that you and I have probably both seen is that the kind of patients that come into the clinic that you work with are not the middle of the bell curve of care, right? These are deeply multifactorial chronic illness where they've been everywhere else and they've gone to every other specialist and they end up there. And, the systems that will be built that to deal with that kind of population sounds like what you're talking about, where you have teams and they discuss and so forth. There's nothing more radically inefficient than a long doctor visit, than a whole team of doctors working on one case, right? That's even more radically resource inefficient. So, I think there is definitely a need for that. What you described is absolutely correct as far as the difference between the different clinics. I guess, in my estimation, the thing that bends the curve of costs, right, to come back to where we started, the thing that flattens the curve, everyone understands flattening the curve now, right? So if you want to flatten the curve of healthcare costs, what needs to happen? The middle of the bell curve of society that is currently pre-chronic illness or chronic illness needs to be well and healthy. And we need to have a large proportion of the country that is well, and then a smaller percentage that has a chronic illness, and then a very small group of people that will always be, probably because of environmental, issues, will be in that category that you're talking about. And so my plan I think I've spent the last 10 years trying to work out what you speaking. Like, one of the things that I saw, for instance, was you need to, in those kind of teams that you're talking about, You need to have a common language. In my estimation, functional medicine provides a common language for a chiropractor, an acupuncturist, a nurse practitioner, a dietitian, and a nutritionist, and a physician to work together as a team, because now they can like identify with that specific patient, where is their function less, where can they build up the function, where should they prioritize their efforts. So that I did that, and I feel like that is, hopefully that is something that's happening, in the minutiae, I guess, and that is relevant. I guess what I've really sort of moved my focus towards now is that middle of the bell curve, and trying to shift the standard of care without relying on doctors to, doctor entrepreneurs to lead, because ultimately I feel like physician entrepreneurship, it might be something that you could bet on in America, but in every other country around the world, it's a disaster, right? Only America has this like history of private practice to such a degree, and it's moving away. And even in the one of the things the pandemic did is took another large chunk of doctors into employed roles. So, the relying on physician entrepreneurship to solve the problem, I don't think is the best plan. And so, what we're trying to do is trying to like make it easy for whole health systems to adopt some form of health created medicine in a way that is profitable and scalable. I don't know if it's the right plan, but I'm just kind of following the thread.
Yeah. I mean, speaking of following the thread, now that we've gone through, 2 weeks to flatten the curve, that's 2 to 3 years almost now into it. I know you post a lot about the pandemic and some of the blunders throughout it, and it still seems like we're going through those blunders, which is a little remarkable because you thought it was over and we could, get past this and go back to some normality. But where do you see things going now as far as medicine? Do you see that will they double down in a sense with big pharma and everything and continue kind of a draconian approach to medicine of, do this, have to do this, mandate, don't care about lifestyle whatsoever, just keep, getting kind of boosted in these sort of things? Or do you see the opening and opportunities for, these community cures to be implemented, for new practitioners to come out, because we need more practitioners anyway, right? There's a shortage. Yeah. I don't think you're going to get them going the same route as we have in the last 2 years. They're dropping like flies saying, I don't want to do this.
No, absolutely. Man, I think it's both simultaneously, right? Yeah. I don't see any, I don't see any, the sort of draconian paternalism part of medicine is only getting stronger. I mean, you see, like with the child recommendation for the vaccine, right? They even threw out the advisory board that would advise them. Like they don't even ask the advisory board if this is a good idea. So, it's going more and more off piste on that end. But, and then, so I'm equal parts like optimistic because I see new things emerging, and I'm working every day on having those things emerge more and more. But yeah, I don't know where the bottom is for, the powers that be, and, how little like humility and accountability do you have to like make so many bad choices. I actually saw it. There was a thing yesterday in the Atlantic saying, hey, should we have an amnesty for all of the super made? And I was like, I think maybe let's start with some accountability, for those choices before we have an amnesty, because ultimately, I mean, there's lots of people that have a right to be, sad about what happened in the last 2 years. I think, I think obviously the children is a huge issue. But I mean, the biggest thing of all is like the businesses that lost business and were put out of business because they weren't able to open. And the, superstore down the road was, that thing was crazy. And so I feel like ultimately, there has to be some accountability. I don't think that's going to help anyone's businesses come back. No. But, what's really interesting, Casper, imagine this, right? If we were having this conversation in 2005 and we met, and I'm telling you, hey, in 2022, there's a whole state that, has a program for the pandemic that involves vitamin C, vitamin D, quercetin, that includes, doing healthy behaviors. If that was the case, like forget about the politics for a moment. We care about health. I only care about health. Like that has happened. That's happening right now. And there's a moment where it's an interesting time to be alive, because ultimately what we're seeing is these competing ideas are like coming together on a bigger stage than they've ever come before. Even that conference on hunger that was a few weeks ago in Washington D.C. I think it was a couple months ago now. Like that was I mean, there's not a lot of credibility in my mind there, because the last time they did it, we ended up with all this chronic illness that didn't exist in
Yep.
the 50s and 60s. But at the same time, the American College of Lifestyle Medicine donated 100,000 trainings in lifestyle medicine to physicians and providers across the country. So, I think simultaneously things are getting worse and getting better.
Yeah.
And I think that if enough of us start to play on, the new paradigm team, we can just, in the words of Bucky Fuller, build the new system that makes the existing system obsolete. It's been on the bottom of my email for like 8 years, and I think about it every day. And ultimately, that's sort of where my head's at.
Listen, I agree with you 100%, James. And I think that if there's a silver lining to everything that's happened in this pandemic, it's that a lot of people have shifted over to this idea that health is the real wealth. Like what I'm dealing with managing my disease, going through a pandemic, being in fear of all this and everything is just not good enough. And they're seeking new options and something to change. So even though I think it's a slow one, because you have so many people that are just, very, very averse to change in general, change is difficult. I think it's going in that direction. So let's keep our fingers crossed and be optimistic about that. I know you got a lot going on. You're traveling soon for a while, but tell us about like the exciting things. Do you have a book number 3 coming out? What do you have in the future?
No more books for a minute.
No more. Yeah.
Look, man, the most exciting thing in my life is getting health systems to adopt these groups. And that's where I'm focused on. So I'm going actually in 2 weeks to, I mentioned the American College of Lifestyle Medicine. They have 100 health systems that have put up their hand to say, we want lifestyle medicine. And lifestyle medicine, is pretty basic. It's the kind of stuff that we're doing. It's helping people do healthy behaviors consistently. But the fact that 100 health systems, and these are some of the biggest systems in the country, like Kaiser Permanente, Intermountain Healthcare, these are big entities that are putting up their hand to say, hey, we're interested in this now. That to me is exciting. And so, I'm focused on, trying to scale this kind of care, to as many people as possible. I've had thought about writing a 3rd book, and I think I would call it The Economics of Chronic Disease. And I would sort of bring in, but it wouldn't be, I don't know. But I don't know if I'm going to do that. I think that's probably a few years out. I really want to be 100% focused in the next 4 years in getting access to as many people as possible of health focused care through the payer system via these partners. And, every moment that I spend on it is like really fulfilling. We're making some tremendous progress. And if you're listening to this and you have any sort of ability to influence decisions within health systems or payers or otherwise, one of the most exciting things, Casper, and you'd be in New York, that like there's been a lot of false dawns, right? So there's been a lot of moments where, oh, wow, there's going to be an integrative center at Mount Sinai, and it goes well for a few years. And then some new investor comes in and buys the hospital, and it gets canned because it's like, well, it doesn't make enough money. And it's like, it's not profitable. Yeah. I think what we have the potential to do here is to create really sustainable, very significant size, health systems that deliver health, health creative services. And I think that is possible. And I think the Great Resignation and people leaving medicine is almost like feeding into that opportunity in a weird way. So can we find ways to get doctors on a path towards, creating health? Can we do it both at the individual level, in the individual clinic level, and then at the health system level? And look, it's going to take a huge team to execute it. But I think there's more and more people, like you said, who are waking up to the fact that this needs to happen, that the best way to avoid COVID and whatever else comes next is to be metabolically healthy. And so, I think that we're going to have to build the right structures to help most people attain that.
Well, it's an incredible mission, and I definitely think we need those infrastructures, and we need more people like you. So thank you for your work. Where can we learn more about you?
JamesMaskell.com is the website that has a list of sort of what I'm up to. LinkedIn, James Maskell, and Instagram, Mr. James Maskell. So you can kind of see what I'm up to on those areas. But yeah, like Heal Community is my main focus right now, and Evolution of Medicine still continues. We have the monthly functional forum that's on the first Monday of every month. We've done over 100 of those now. We have podcasts. The Evolution of Medicine podcast comes out twice a month. So we're going all in.
You got to go all in for this fight. It's a fight worth fighting for. It's health. It's our future. It's what I consider the biggest challenge of our time. So, yeah. James, thank you so much for coming on, and thank you for your work.
Appreciate it, man. Thanks for the chance to connect.
Yeah. So with every new challenge comes new opportunities, and the healthcare system in America is teeming with obstacles that require creative solutions, just like James has presented, that call for a new level of thinking and a complete overhaul of our outdated institutions. Check out his book, The Community Cure, and be sure to look him up at jamesmaskell.com. Until next time, continue writing your own healing story.